Why you are using ultrasound? Of course, it make the insertion in difficult people easy, and it can overcome the contraindication, as we mentioned before, like coagulopathy, like anatomical distortion, like morbid obesity. And of course, in case of central line, ultrasound can be safer and avoid complication, mechanical complication, and can be diagnostic of complication or of also. As you can see here in the picture, for example, internal jugular central line or subclavian central line. But the common complication, one of the common complication of subclavian central line is pneumothorax. Usually people avoided subclavian central line because they're afraid from pneumothorax, which is not valid with the use of ultrasound. But even that, you can scan the lung before insertion of central line. And in normal patient with normal lung, you can see this image on the left side, which is a lung sliding. As you can see, the two pleura sliding over each other, this shimmering movement. This is called lung sliding, and this is normal. The parietal and basal pleura sliding over each other give you this picture, which is called lung sliding sign. This is normal. In case of pneumothorax with the central line, or in case of diseased lung, and it will be, you will not see lung sliding as the picture on the right, absent of lung sliding. So what is the common practice? The common practice, for example, I'm going to insert subclavian central line. I'm going to scan the patient, for example, the right side of the patient, the lung of the right side of the patient, and I will see the lung sliding, the beautiful lung sliding here. After ultrasound guided subclavian central line, I will scan it again. I will see the lung sliding is still there, so no need for X-ray. There is no pneumothorax, definitely. So another way, another helpful point with using of ultrasound in vascular access is to make sure, for example, in central line, that the central line is in place. How you can do that? But in this view, you have to change the probe to cardiac probe or to curvilinear probe. You can inject irrigated saline or normal saline with a push in the one port of on one port of the central line, and with the cardiac probe in subxiphoid or subcostal view, you can see the fluid coming from the right atrium to the right ventricle, as you can see here.